Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. I'm going to tell you about the medication Venlafaxine. It's a popular antidepressant, Venlafaxine. The topics that we'll cover in this video include what is Venlafaxine, the common uses, both the regular and off-label uses. We're going to discuss the common dosages, the most common side effects that can occur with venlafaxine, some of the other side effects, warnings, precautions, discuss the potential for withdrawal if you have to stop the medication, then drug interactions that we need to watch for with this. As with all my videos, this video is for informational purposes only. It doesn't serve as a substitute for your healthcare provider. Always speak to your healthcare provider before you make changes to your medications and or lifestyle. So first off, what is venlafaxine? It's in a class known as SNRI, or serotonin norepinephrine reuptake inhibitor. Just increases the amount of serotonin norepinephrine available in the neural synapse, which has antidepressant effects. In the US, it's sold under the brand name Effexor XR. It's available in regular release as well as extended release tablets and capsules. The extended release version is more popular, but we do still see the regular release tab used. What are the uses for venlafaxine? The approved uses include generalized anxiety disorder, major depressive disorder, panic disorder, and social anxiety disorder. Other uses or off-label uses, meaning it wasn't initially studied for this, but over time we found it can help improve these: ADHD, migraine prevention, narcolepsy, diabetic nerve pain, OCD, PTSD, menopausal symptoms, premenstrual dysphoric disorder, and other conditions that your doctor may want to use this for. Just found over time that oftentimes this medicine can help improve those conditions as well. Okay, so what the venlafaxine dosage? How do you take it? When is it taken? It's generally taken with food. Oftentimes we start at that 75 milligrams per day and work up as tolerated, slowly as the dose is tolerated, and if the symptoms are not improved as we'd like. The maximum dose is generally 225 to 375 milligrams per day. That depends on your condition as well as what you and your healthcare provider decide. Now, keep in mind, as with all the antidepressants, it takes weeks for the full benefit to be seen. So it is something we have to give some time. And we want to avoid using alcohol with venlafaxine. It increases the risk of liver damage, as well as in the alcohol together with venlafaxine increases impairment, meaning your motor skills could be impaired more than normal. What are the most common side effects? Insomnia, 18%. Nausea comes in at 30%. So 3 in 10 who take this medication may experience nausea. It can improve the longer you're on the medicine. Taking it with food can sometimes help. Dizziness can occur. Drowsiness. Diaphoresis, that's excessive sweating, can occur. Xerostoma, dry mouth, can occur in 15% of folks who use this medicine, and just weakness in general, about 13%. As with many side effects, a lot of times these can improve the longer you're on the medicine, but if it is bothersome, it doesn't seem to be improving. Certainly is something you'd want to chat with your healthcare provider about. Other side effects can include anxiety, bleeding, blurred vision, increase in blood pressure. It can affect sodium in the body. It can increase cholesterol. There can be some sexual dysfunction that can occur, tremor, vomiting, weight loss, change in heart rate, change in dreams, hair loss. Hair loss less than 2%, so not super common to occur, but can occur. Itching, rash, as well as other side effects can occur. What are some of the warnings with this medication? As with all antidepressants, we need to watch for suicidal thinking or behavior. Extremely rare, but it can occur. Mania in folks with bipolar disorder. This medicine can push them too much in the positive direction and they can have manic episodes. Serotonin syndrome, again, something that can occur with antidepressants. Not very common, but it's a noticeable change in, you might get muscle tremors, like excessive sweating, almost like seizures, change in body temperature. It's just, you just feel terrible. There's usually kind of a sudden onset, and that would be require immediate medical attention. It can affect vision. It can increase blood pressure. There is a risk for seizures, probably people who are more already at risk, but that is something to consider. The bleeding risk we kind of touched on a little bit, and then the dose is reduced in people who have poor kidney or liver function. So those are all things that you and your healthcare provider can talk about as this medication is started. Withdrawal. After you've been on this medicine about 3 weeks, it's recommended you don't stop cold turkey. After that point, you want to taper. And I've had many people tell me the same thing. They just don't feel right. They have odd sensations in their head. It is something that most people really want to taper. And you need to slow the taper if symptoms emerge. You know, a lot of times a taper over 2 to 4 weeks is enough, but some people may be more sensitive, and it can take 3 months or longer to taper off the medication. So something that you want to, if you're wanting to go off of the medication, you need to work with your healthcare provider to make it the most comfortable as possible. And even with a taper, some people still have difficulty going off this medication. Interactions. The interactions we really want to watch for, we discussed some of the side effects. So it has that heart and blood pressure side effects. So if you're on blood pressure medication, you're on cardiovascular medication, anything for heart rate, it can increase your blood pressure, it can increase your heart rate, so it can counteract some of those medications. So it needs to be used cautiously in people with high blood pressure and people who are already taking medications for their heart. Anticoagulants, antiplatelets, NSAIDs. So as we mentioned in the side effects, there's a potential for bleeding. So these medications also have a potential to increase bleeding, especially in the stomach and the intestines, the colon. So it just increases the risk. It doesn't mean that these medicines cannot be used. It means that you need to be aware, your healthcare provider needs to be aware that this can occur. Watch for signs and symptoms of bleeding. And if that occurs, you want to seek medical attention right away, of course. Other antidepressants, again, they can be used together, but it just increases the risk of side effects with both. So that's just something you need to be aware of if it's deemed that you need more than one medication, more than one antidepressant. Other mood medications, other medications used to enhance mood, again, same sort of thing, can put you at higher risk of side effects. Tramadol is a pain medication. It can put you at higher risk of serotonin syndrome. Sumatriptan is a medication used to treat migraine headaches. Again, we just worry about increased risk of side effects, as well as others. I just kind of covered some of the bigger ones. You always want your doctor and your pharmacist to be aware of all your medications that you're taking so they can screen for side effects. Thanks for watching. I hope you appreciated this information. If you do, please like this video, and I'd love it if you subscribe to my channel. Go ahead and ask any questions in the comments below. If there was something I didn't cover in the video, I will do my best to answer it for you. Thanks again for watching.